we as an organization have been doing research for a long time, and we're in constant contact, like most groups are, with their constituents. But we didn't have a formal mechanism to every year or two go to them with a long list of questions to collect information that would inform our program. So we did that in a really robust way in 2010 and asked a lot about technology and social media and what are the tools and issues that our cancer survivors were facing. And the information was very significant. It was that they wanted to share their information. They wanted to give access to people who needed it, whether it was family or physicians or healthcare providers. They wanted to control the information. They felt like they owned it. It was theirs, and yet the system didn't allow for that. And interestingly enough, they were less concerned about privacy. They felt like they had shared their story publicly. They felt like in order to get what they needed to share it, and privacy was not the top concern by any stretch. So we just listened to them and then tried to look for solutions that we could develop or co-develop to serve those voids. We have to figure out a way for patients to not only have access to their information and control it, but to have the ability to upload or share when they want to. Right now, all of the various electronic health and medical record systems don't interact, and that's the biggest challenge, is when somebody leaves the hospital or cancer center or doctor's office, what do they take with them, and how are they enabled and empowered to share that information? So we're trying to develop a prototype exchange that allows people to say, I want to sign up and I'm going to upload my information, and then I control who gets to see it and how it's used. This information isn't shared and it hasn't happened quicker is I think there's an institutional desire to hoard the information. I don't think there's the will to actually do this. I think that hospitals and academic medical centers, they are incentivized to keep that data to themselves. And they know that they should share, and they know that there's got to be a system for sharing, but there isn't the will or the system. So it's a combination of the technology and the desire and the will to do so. And there's some progressive groups that do it and are starting to do it more efficiently. But ultimately, we hear from patients all the time who say, my hospital won't even give me my records. They think they own it. And the patient says, how could they own my information? And the reality is there's just so many barriers to get it that a lot of times the patient stops or gives up and doesn't follow through. But if there's the will, the technology is there to make this happen.
So how do you change the will?
That's a tough question. I mean, I think ultimately you have to show that this is good for everybody. I mean, it's like physicians love highly educated patients. It makes their job easier. So as a physician, you would think that you would encourage second opinions, you would encourage the sharing of information because the outcomes would only be better. So working on those incentives and then working with institutions who really see the bigger picture and realize that none of us are going to advance our goals and missions unless we all work together. Easier said than done.